Hi, today I will be talking about the rights-based moral theory in nurses who are dealing with abortion. Nurses have a duty of care due to the patient's right to safe, competent, and non-discriminatory care. Nurses must provide proper assessment, monitoring, and advocacy for their patients. Failure of duty of care can look like medicational errors, failure to monitor, inadequate communication, and negligence. Furthermore, nurses are obligated to ethical and legal biases. Ethically, nurses must perform with compassion, respect, and commitment to patient safety and welfare. Legally, nurses must abide by tort law, Nurse Practice Act, Standard of Care, HIPAA regulations, and several federal and state laws. Nurses dealing with abortion in the workplace face three main points: patient autonomy rights, nurses' moral integrity, and patient welfare rights. The nurses must make sure to provide non-judgmental care as it protects equal moral worth of the patients. Personal beliefs of the nurse must not interfere with the patient's medical care either. If they do refuse, then it is the nurse's responsibility to pass that care of the patient to another professional to ensure patient care and rights. Nurses also must advocate for safe and evidence-based care to ensure the mother's safety if an abortion is to take place. The American Nurses Association enforces that nurses must support a patient's right to access of reproductive health services, even if they ethically do not stand for abortions. Also, the Code of Ethics for Nurses states that nurses' primary responsibility is to practice with compassion and respect and to recognize the dignity and uniqueness of each individual. The second point that I have is nurses have moral rights and are entitled to conscientious obligation. Rights-based moral theory is grounded in mutual limits. One person's rights cannot completely erase another's. This looks like even if a patient wants to have an abortion, the nurse does not have to oblige to that as long as they pass that treatment and care of the patient onto somebody and make sure that that patient's rights and safety is not hindered. By practicing conscientious obligation, mutual limits are ensured in the manner that the nurse's right to moral integrity and ensuring proper care is still given to the patient. Ethical practices allow the nurse to reject participation in the medical procedure as long as patient care is not abandoned. Also, it's the nurse's responsibility that they should also consider the medical practices and if abortions are allowed in that hospital and whether or not that aligns with their moral rights. The third point that I made was patients' welfare rights. In rights-based ethics, a patient's right to life and emergency care outweighs a nurse's rights to conscientious obligation. As I have said numerous times, nurses must prioritize patient safety and dignity. It will go against ethical basis if they abandon the patient in the case of an emergency situation. Although nurses can face legal consequences even when acting to preserve life if they are in a state where the state laws do not allow abortions. In these states with restrictive laws, it is a nurse who deals with the consequences and benefits of abiding to the law while providing care to the patient. They can look to the code that outlines all the thought processes that must be taken, but it must be stated that nurses are not to go around breaking laws all the time. Rather, when they are faced with ethical tension, they must put the patient's rights and privacy and confidentiality first according to rights-based theory. In addition to this, nurses have the duty to protect their patients from unjust harm. In conclusion, a rights-based moral theory highlights the complex balance nurses must maintain while dealing with abortion care. As I have stated with my 3 points, they must provide non-judgmental, competent care with unbiased information. They also have moral rights and are entitled to conscientious obligation, and they must prioritize and advocate patient welfare rights. This topic is very complex and must be navigated in a orderly, fashionably manner, and also the patient and the nurse must be very well informed. Thank you.